My Doctor, your health anytime, anywhere.
Hi, lovely people. My name is Mwesigwa Joy. This is the My Doctor podcast, and you are welcome. Thank you for tuning in. And so on this podcast, we normally do health talk. We talk about health, the entire health, all the aspects of health, whether it's signs and symptoms. We just want you to be able to live a healthy life on your own, right? And so we talk about things, all diseases, all infections. We talk about the law that concerns health. We talk about telemedicine. And today we're here to talk about telemedicine, right? We're going to be hearing from the founder of My Doctor, Mr. Innocent Kawooya, and we're going to be walking through the journey of how telemedicine has been transforming Uganda. Where did we start from? Where are we right now? Where are we going? What challenges have we been facing? Hello, Mr. Innocent.
Hi, Madam President.
How are you today?
Very excited to be hosted home.
I know.
Yeah.
Could you please introduce yourself to anyone who may not be knowing you?
Yeah, well, I'm sure very many people are watching us don't know me, but my name is Innocent Kawooya. Nowadays, we add an NIM to the name, National Independence Medalist, and sometimes we tell people made of God, but all the time. I am blessed to have been born in the Pearl of Africa, and I've lived here for the last more than 3 decades. Someone shouldn't be counting my age as much, but I'm happy to every morning of my life be blessed to be working with very amazing individuals, very passionate individuals, hardworking individuals, especially youth and women like you. And every day of my life, I spend it either developing career of different individuals, mentoring different leaders, also, or maybe starting up a new organization, a new startup, a new innovation. That's what I've done pretty much for the last 20 years of my life. And I'm very delighted to have an opportunity today to speak like as if I'm a doctor, yet I am not.
I know.
Yeah.
Okay, so for today, our topic is telemedicine. And I thought about using My Doctor as a model for the discussion because it has walked through the entire journey of where we started with telemedicine in Uganda and everything. So I'd like us to start by maybe introduce to the people what My Doctor is, like a view of My Doctor before we go into the nitty-gritties.
Now, I would be happy to actually talk about My Doctor as what My Doctor is. But many times, I am happy to even talk more about the ideology of My Doctor and many other innovations that have happened. But I'll take our viewer way back, probably up to 1960, the early 1960s, where what we call telemedicine starts from. I don't know whether, Joy, you've heard about this story, but telemedicine started at an airport where people in transit and people traveling across different borders would be tested from different rooms. One had cameras that would be watching individuals that need to be tested, and another had TV screens that would have specialists reviewing people and talking back to them. And they were using televisions. So the TVs somehow became the earlier part of what they call telemedicine.
Why an airport though?
Yeah, there was need for, I think, specialty healthcare, and then these people needed the service. Some people could collapse at airports because of long waiting hours. Some could get basic infections and maybe some symptoms that need some specialized attention, so they would be helped. And of course, I don't want to share all the information in this particular episode because someone should take time and research and know where this comes from. But it starts from such places, and they were using cable connectivity. Every one of the cameras, every one of the TVs was connected to a cable, so they could transmit data from one point to another, from one room to another. Like when we talk about connectivity in internet, we talk about LAN, what we call local area network. We talk about metropolitan area network. We talk about wide area network. So all of these have been advancements in connectivity. That today we have the Wi-Fi's of this world that allow for seamless connectivity, either leveraging sea cables or satellite connectivity and the likes. So telemedicine started from an ideology of people wanting to have an interaction with a doctor that they cannot see physically, but they're able to interact with them, depending on wherever they are. So like I've mentioned, the metropolitan area networks, the wide area networks, the local area. Local area in our language of connectivity and internet technology typically means connecting devices within a local premises, and you're using wires clearly to connect from one point to another. Of course, there has been advancements and innovation in the same. So nowadays there is LAN that is not typically wired, but it doesn't allow data to flow out of that network. But others like metropolitan and wide area allow for access. That is why today, as we speak big about telemedicine, you would want to look at the advancements like in surgery and say, oh, what much has been done? Someone can be operated from very far across the continent, and there is no problem with them doing that. Why? Because it is typically okay for someone to have devices and tools that allow for them to be operated, and life goes on very easily. But to go back straight to your story, I really like going around questions. It is my way of doing things. I really always like making sure I make my case clear for everyone that is watching us. So telemedicine from a Ugandan perspective, for us here, I don't know about so many cases, apart from people who had traveled away from Uganda and maybe had first-hand witnessed the purpose and how people are actually doing a bit of tele. For us here, it comes as an idea of innovation when one time ITU, or what they call International Telecommunications Union, announces a competition where they were awarding $10,000, 5,000 in cash and 5,000 in mentorship to a winner who would come up with the best innovation, either in healthcare, in education, in agriculture, and the likes. So I remember I was somewhere in Kawala that time, and by that time I was teaching in Makerere as well. So I remember myself and John Mark were discussing the requirements for submitting. And then for me, I had long been very tired of walking to hospitals. I was long tired of lining up just not to be worked on. You walk into a public hospital and then you line up for a whole day and then you don't see the doctor. They walk by you. Like the doctor walks away. Like, I'm done. My duty is done. So I cannot be here. So for me, I was seeing that if I used to say that I'm not as unconnected as many human beings, because from my childhood, I really had access to leadership at whatever level. If it was school, I could talk to a teacher. I could talk to a DO. I mean, I was born to a head teacher and I knew how to go around administration. So I was like, okay, how about if we find something that bridges the gap between a patient and a professional caregiver or service provider without them having to physically meet? So by that time, some of us, Joy, I'm sure for you are like 3 or 5 years.
What year was it?
2009. Yeah. You were just 5 years. Yeah. So by that time, the old us was saying, okay, we all had phones. We were having our capabilities, the Alcatels, the Siemens, whichever, Nokia,
Motorola.
connecting people, Motorola, Bad, and the likes. And whatever phone we were very, very fascinated about the fact that we now had devices that we could walk with in our pockets. Some people, majority of the people in the world, didn't have a chance to see the wired phones.
Wired?
Yeah.
Where would the wired go?
Yeah. Did you ever see one?
Like the ones in offices?
Yeah. But the ones in offices still don't have cables now. They only have a wire to connect
like the phone booths in school?
Yeah, that one is also not a wired phone.
Really?
Because that one is also kind of a mobile phone booth. It can be taken to another place without having to plug any wires, apart from connecting it to the electricity grid. So the phones you will check whoever is watching us, including Joy, will check out for the series of phones, how we have transformed in telephony and up to where we are. So we had witnessed things like how people could use those phones with services provided by Posta, or what was later called UTL. You heard of Posta. So Posta Uganda was the arm for communication. And if someone tells you about how people used to connect a call to another, it is very, 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 very amazing. I remember when I was teaching in Makerere, every one of my classes of introduction to internet technologies, I would tell people about how someone had to manually plug a cable from one point to another. I am calling from Kabale and I'm calling someone in Bale, someone in Bulambuli. So I need to pick the cable and connect what they call from Bale or from Kabale to Bulambuli direct, or to Masaka or wherever. So we had been through all those kinds of advancements, and for us who had seen part of that progress in communication, with the existence of mobile phones, I mean within our own circle, every one of us had a mobile phone, much as they didn't connect to internet, but by that time everyone had a mobile phone. And then many of us had access to computers. We had for about 4 years been running HiPipo.com, and it was the biggest social network around the African continent. And we had seen that there were ways of connecting to people in different ways. I mean, we had more than 50,000 people from universities across Africa, Asia, and the likes connecting on a network that we had sloganed friends and friends of friends, or friends rendezvous. So we were sure that there was a way of connecting to people. So we were saying, imagine if these friends are doctors and patients. Imagine if these friends are public officials, regulators, funders, caregivers, and the likes. So to go back to the ITU competition, so we decided to say, okay, time has come. So I told Mark, okay, I think the best thing for us to do is we are going to do two things. One, we are going to create two new ideas. Then we are also going to submit HiPipo as a solution. So we submitted HiPipo. We made 3 proposals. HiPipo, then we did My Doctor. So the first thing that came to me is the name. It's like, how do I want to call this kind of person that connects me directly to the doctor? I'm like, this platform should be called My Doctor. So if the platform should be called My Doctor, then I should clearly have access to a doctor anytime, anywhere, as long as I can access them, as long as I have a mobile device, which doesn't need to be smart. But I can SMS. We had earlier developed the first ever email to SMS platform. I don't know whether you know email to SMS.
No.
So most guys who are in campus by 2008, 9, many of people in Uganda, Pretoria, in Asia, used HiPipo a lot to send free SMSs using internet to phones. So when you are at campus and you don't have food, you would send Mr. Mwesigwa a message using HiPipo. Say them, Dad, I'm hungry. I need some food, because maybe you don't even have a phone. So we had created such solutions, and we knew that there was very many possibilities of creating seamless communication. So we said, can we specialize this? So we proposed My Doctor and another platform called Afro Examiner. I wish I talk about Afro Examiner one day. Yeah, and when we did that, by that time, for me, I was a newcomer sort of in engineering. I was doing real code. I designed a number of websites by that time. I'd done very good programming, but I was a junior compared to the seniors I had by that time. So we were bootstrapping WordPress, we were bootstrapping Joomla, Drupal. All those are very technical terms, but they're not very technical nowadays. Too many people have started IT. I'm sure when you ask your colleagues who are doing IT. But I can also tell you here, they are called content management systems, or CMSs. So we're like, can we work with one of them to customize? So we worked with Drupal by that time to customize and build a digitalized healthcare community for people around Africa, for patients, for caregivers, for professionals like doctors, nurses, clinicians. I'll first stop there for now.
So, yeah. No, you can't stop there.
No, I'm just saying I want you to ask me.
No, okay. Take us to the competition, because I'm really interested. I scared because that story is interesting.
Yeah.
How you've reached the competition. So how does that go?
Yeah, so we develop a prototype, and we submit to ITU, International Telecommunications Union, and we wait for about 3 months. And then one day, an email comes. Congratulations! Your innovation is such an amazing one. We are sponsoring one of you to come to India and participate in the finals. And My Doctor and HiPipo had won. And we're like, okay, now this is beautiful. So, I mean, things happened. We won the challenge. So, we won the challenge. And then we bought the money and used it to pay rent, because we had the rent areas where we used to stay. So we got the money, paid for rent, and bought data from Orange by that time for a whole year. And then we said we are going to spend the whole year working on building My Doctor, building HiPipo.com, building Afro Examiner. And it really went well. Now, at some point...
Which year are we in now?
2009.
9, okay.
Yes, so by the end of 2009... we have done a lot of the development, and it's really working. For someone who can search Wayback Machine, you can find a number of the old pages of My Doctor. Of course, the domains have been changing. For the first time, we are the only ones who had mydoctor.com. Then because of the challenges of cards and payments, we lost a domain.
Okay. Because
we missed paying for it for about 5 days. Someone wanted it, so they bought it. Then next we bought my emdoctor.com. EM meaning My Electronic and Mobile Doctor, but still we were branded as My Doctor. So we bought that, and then that worked until I think up to 2013. And we were still making sure we build a digitized healthcare community that allows for sending digital SMSs, that allows for sending reminders to patients. I mean, if I have a schedule to take medicine, my prescription, we have a platform that will remind you, send a notification, like the notification you hear Director George receiving. Hello, sir, it is your time for lunch, to go and have lunch. Hello, madam, it is your time to check your temperature. It's your time to check your blood pressure and the likes. So that was the vision we had then, and it still is today. And we were thinking we have this capacity to do this. And we had built a very robust solution that had all this functionality. I remember we were using Modular, and we were using some other prototyping platform. So we had built a very robust architecture for My Doctor. I have not seen any platform done, whether for healthcare, for sports, for education, that is as robust as the architecture we built for My Doctor in 2009 and 2010. Now we concretized this later in 2012 and made it even more complex in terms of the architecture and the back end, but also very user friendly for the front line. But as we're doing all of it, now came in the reality of implementation. The reality was that none of us had ever had a vision of becoming a doctor. None of us had ever trained.
So actually, how did that go? Because I feel like you needed doctors, right, to do it. How did they welcome the idea? Did they see what you were seeing? How did that go?
Well, I just thank God, first of all, for our patience, especially for me, because I kept on. We had an auntie, probably one of the best doctors I ever saw, as long as she lived. May her soul rest in peace. So our auntie was by that time a midwife. I think she had become a clinician by that time. And I kept telling her, we have something we can do here. It would be nice for you to be our lead and technical lead and make sure we deliver digitized telemedicine services. And then she'd be like, oh, that is nice, but I'll think about it. That year ends without her actually thinking about it. Another year comes by, you tell her, oh, there is this something that I want us to do. And then she's like, oh, okay. So by the time she died in 2021, she had accepted actually to partner and offered us 5 acres of land to build a telemedicine model hospital. And that was going to be My Doctor there. But still, we are talking to other people. I remember talking a lot to my friend, Dr. Peter Antege. He's our age mate. He also never believed us for a long time. So every time when I told him, my doctor, can we work on this? He would tell me, can you afford me? How much you need? The first time he tells you, can you pay me 9 million per month? Then you're like, oh yeah, I can pay it, but I don't have it right now. But I would be happy to pay with the money if we're doing the right job. Then the year ends. Then we get into another. For me, I never put my doctor off my desktop. Not one single day. As in all the time, there was always my folder for my doctor, and I always believe that this is a lifetime solution that will solve problems of people even 1,000 years from where we are here today, Joy. So I kept telling him, and all the time, before I knew, he had moved from serving. He had graduated. He had moved from serving in the basics of what he called basic for himself. Before I knew, him and many other people, we had meetings with people all the time. We talk. When we are in the meeting, we are very excited, and everyone is saying, "How did you even think about this innovative thing?" So some doctors who had been a part of the conversations we were in, like the competitions, started some kind of telemedicine innovation, but they were very basic. Simply saying, we are offering online pharmacy, you can call and then you get medicine, you can order, things that I still see as very basic. I don't want to use a demeaning word, but in my point of view of what the transformative capacity of telemedicine can be, I always thought that we were very basic, that someone is saying, hey, you can call, we can have someone come. Like you saw today, someone, I needed to have a test, and for my doctor, I will text someone on WhatsApp and I will get someone working on me immediately. That is the starting point of telemedicine. And that is the most basic thing that anyone should be able to do. Any nurse out there, any clinician, any doctor that is licensed should be able to do such a service. They should be able to tell people, I can test for malaria, typhoid, hepatitis, whatever, because it is doable. Get on a border, have your nice uniform, move wherever you want and work on people. Be their family doctor, maybe for 50, 20 people. Imagine when you have 50 people who pay you 50,000 shillings a month. So you pay 2.5 million. And that goes tax free. You only get taxed as you're buying stuff from supermarkets and the likes. So our vision was saying we can leverage technology to connect communities affordably.
Maybe yes. I could ask if you talked about basic, like just the texting and then a doctor comes. So what more is there, like that is, you get what I mean, yeah?
Yes,
what more is there in telemedicine than that?
The more is customization. The more is humanizing technology and making it work for us. The more is leveraging things like AI today and make sure that before we take every burden to a doctor, where we have a very bad patient-doctor ratio, still having 1 to 25,000, yeah? Before we do all that, we can have a conversation on SMS, send a text and say, I'm feeling some kind of headache. What might my problem be? Maybe ABCD is happening. So for people who can read, the more is saying we can use radio technology and convert text to voice. That someone out there who cannot read, but they know a language, can send text and then they get a response with voice. The more is saying, I am supposed to visit a doctor 3 times in a year. So when I have a profile with my doctor, for example, I get profiled and get scheduled. I know I have the alternative dates that I can meet someone. I know where it is dangerous. You've seen applications that women use for checking up their cycles. The more, because that is just an element of telemedicine. The more he's saying, even that should be incorporated. The more he's saying, this is my next of kin. They should be able to see my schedule because they should be able to remind me humanly. The more he's saying, when you have an initiative like Godmother, a mother should know when they should have antenatal services, not just by reading in a book. I can forget. I can see a 6 and think it's a 9. And then I don't go in June, and then I only go in September when you're going to be delivering. The more is, continuously having personalized attention of systems and also professionals that know that Dr. Joy will know that I have 100 patients that I need to look up for in this month. And someone has a chronic illness and I need to be sure they were able to run for 10 times in the month. I need to be sure they're taking enough water. The more is making sure that we don't make people lazy, but we create a synchronized way that is seamless, that allows for people to interact in real time with technology, and it helps them solve their healthcare challenges that would cause them death. I mean, very uncertain death, that someone who would be dying at 90 years dies at 37, yet their problem has been known and has been treated for thousands and thousands of patients, and they have been able to live longer. So the more of telemedicine is really creating lifetime profiles for healthcare, yet they are protected, yet they are personalized, so no one is going to be misusing your data. Yet you're also able to learn more, that when I come to a platform like My Doctor, it should be able to help me understand why I'm not supposed to be taking paracetamol, why antimicrobial resistance is a problem for me. Why? Because I am walking into a pharmacy every time, and whenever I walk to the pharmacy, I tell the system, I've been feeling a headache today, but I bought an antibiotic X. So the more for telemedicine should be also creating affordable access to healthcare. And what is the most important thing? That affordable access, that everyone should be able to access a doctor around the world. It's a right for someone to have healthcare services. It's a human right. Like the UN declared internet as a human right. Healthcare was probably one of the oldest, oldest profession, that before anything happened, people were giving birth. So meaning they should have been a birth attendant somewhere, either the person delivering or their friends or their relatives and the likes, family. So the more of telemedicine is humanizing while making sure we leverage digital. So how do we humanize technology? Make technology understand that we have challenges that are continuous, and then use it continuously to make sure it solves the problems. Yes.
Yeah. So as an expert in telemedicine, I'll call you an expert right now because you have experience. I'd like you to give advice to the health workers out there, because I feel like we have two groups of people. Some see technology as an assistant, others see technology as a threat. They're like, the technology has come to take our patients, but the ratio is still too big anyway. So what advice would you give to the doctors out there in regards to technology?
Thank you, Joy. Well, even when without saying expert, I have spent more time than most doctors using technology for healthcare. That is a fact. It is a statement of fact. Though I would call myself a specialist. Why? Because I'm not just passionate, but it's been one of those areas I've specialized in researching about, understanding advancement. Just recently, remember when we were having conversations of the healthcare entrepreneurship course, and I realized that we were in a room where people, not because any of them is ignorant, but because we've been looking differently about life and healthcare. Yeah, I have told people many times that technology, not only for doctors, whether you're a teacher, whether you are an engineer, technology is supposed to be a tool that should help you better how you serve people. Technology should be an instrument that you command and use to do what you want, as opposed to thinking that technology is going to take your job. Well, all the time when people think that technology is going to take their job, you know very well, Joy, that in this room, all of us here are using technology to earn a living, and we've done this for the last 20 years. Everything we use is technology enabled. Everything we use has to depend on electricity because we need to charge our devices and the likes. But I can only tell people that my testimony alone has only been advancement after advancement, has been progress after progress. Why? Because a computer, for instance, or there are tools like those feature phones that we used to call personal digital assistants. There are tools like watches that were also regarded as PDAs as well. And if someone never appreciated the value of their time, they never appreciated the value of a watch. Right? That is why someone would be late, regardless of the fact that they have an alarm clock, they have a watch on their wrist. And they know that clearly this is supposed to help me catch time. If I'm supposed to have a conversation at 3, I look at my watch and I need an hour to travel. I need 2 hours to plan. So I need to move early. So the watch, just like technology, because they're all advancements in technology. Today, the phones you people who use iPhones have. Yes. The phones that you have. They are typically very advanced and in ways that someone cannot imagine. That same phone, even without that same watch, even without your phone, you receive a call. You can type stuff. You can use it to have your schedule, your calendar in the same place. You've seen those memes of one device that took away relevance of so many. The calendar, the watch, the radio, whatever, everything came into one place. And for us, we were saying, okay, telemedicine actually should be that thing that uses everything for the advantage of and the goodness of everyone in the world. So for doctors out there, nurses, midwives, and the likes, I would tell you, Move Marala, like I would say, don't play. Yeah, use technology to make you better. Use technology to connect you to people you would otherwise not connect to. Today, Joy, I know people from all across the world. At least in every country, I know one person. And I've not been to all those countries. That's a fact. But we connect with them by using internet, by using social media and the likes. I'll maybe take you back to the facts of what has happened in innovation. There have been probably about 3 or 4 things that have really, really changed how we do almost everything in the world. And the rail has been main. It has been typically internet. But when you look at internet, you look at things like, one, the web came in. When the web came in, the web became fascinating because for the first time, post office was challenged to run for its money. So the post office could no longer brag and say, your mail will take a month. You have to wait for us. As someone is sleeping on the job, I took my letter. They keep it there on the table. They don't want even to walk to the place to post it. And then it stays there for 2 months. But I have to wait because there's no alternative. The phone calls, not everyone had those wired ones we had back in the days. So you need to walk from one town to another to find someone who has a phone to call your relative in London or in Amsterdam or in Sydney or wherever. Now that mobile came and challenged it in a certain way that people could buy their cells and move wherever they are, wherever they want to go. So the phone could come to you, not you walk into it. Now the web, with the likes of Netscape, with the likes of Google and the innovation that allowed to search for information online. I mean, they built crawlers that allow for easy access for information. So people who were bossing around in libraries lost relevance because the librarian would become a problem for girls in a university because they think they run the world. They would boast around. Of course, some people would go and steal books. Now, the web the web became a problem for people like, oh, wait a minute, sir. That book, someone can actually get it online. Some of the information is there. So, the relevance challenged those who are in the libraries, the physical libraries. Some have innovated differently, and now they have created hybrid libraries. They are digital and physical. So, someone can read from a library from their home. And others can have computers, devices in the library that integrate their data in one place. So the web became a big advancement and probably one of the biggest innovations. I mean, the enablement of things like Internet Explorer, the browsers and the likes that are software that is used, and organizations like Microsoft that played a very major role in making sure access to computers became more affordable every single day, were very useful in that stage of the web. Now, when the web happened, over the web, something happened. Can you guess what that is?
Give me a hint.
No, just just guess what you think. No hints. So when the web happened, the next thing that happened was social media. Social media came, and it came in a very democratized way that it allowed all of us to broadcast ourselves. So whatever I thought like I would want to tell the world, I would run and share text and have a picture. I remember those first days when people were uploading pictures on HiPipo's social media platform. Someone goes to the cafe and scan. I want to send a shout out to everyone who made effort to go and scan their pictures and have their profiles looking nice on HiPipo. You are the heroes of this world. You were not born by that time. We were still very young, I can assure you. So now the web happened, and then social media came in, and you've seen the TikToks of this world, the Facebooks, the Instagrams, the WhatsApps, the Twitters, everything that you've seen. I mean, HiPipo is in the same conversation. So when all that happened, the web now got a usable use case that became an enabler for thousands and billions of people. Today, TVs have a run for their money. Why? Because there is a second TV, and I find it on my phone, and it's almost very free, the YouTubes of this world and the likes. So I can access a lot of information and content. So when all that happened as well, we went to the other side. Can you guess the third one? You can surely guess it, I'm sure.
I can.
Yes, please.
After social media.
Yes. You can guess it. Please do guess it.
After social media.
Yes.
But we're still at social media.
No.
Probably like another type of social media.
And another type of innovation.
Of innovation.
Yes.
Maybe the teleservices.
Again?
Teleservices.
No.
Huh.
You know it. It helps us to do so many things.
ChatGPT.
AI.
AI.
So now AI comes in. So unlike so many people, and we'd never blame them, so many people actually use AI, think it is a thing for today. But we have used AI for a long time, and advancements have been happening. Innovation has been getting better and better over time. So today, on top of what internet brought, creating access to connectivity and opening boundaries so that I can send an email to someone, they receive it in Seattle in 1 minute. So if I wanted to talk to a colleague, a friend at the Gates Foundation, I just need to sit on my computer, send them a mail. So the LinkedIns of this world have adopted the same format. They also have the same functionality. Every other platform allows to send a text. It depends on the layer of formality that I want to run something. Otherwise, I'm able to communicate. So in everything, because I cannot say all that I would want to say about telemedicine today, in everything, we are now leveraging the entire flow of innovation, from internet access to the web growing, to social media, to now artificial intelligence. So now, thinking My Doctor, we are bundling everything into one place and saying we are going to milk everything to make sure every person in the world, starting from Africa and Uganda as the Pearl of Africa, has access to affordable healthcare, quality healthcare services wherever they are, anytime they want it.
Okay.
Yeah.
So as we close, so where are we as My Doctor? Like, so someone could be watching out there and they're like, oh, these services, how can I access them? Like, could you give us like a step-by-step way of accessing the services of My Doctor to someone who, just has their smartphone?
Yeah. So anyone who has a phone, smartphone, whoever has a chance, whether you're watching us from your neighbor, I'm sure the screens will show you numbers. And the numbers, typically to guide you, you can SMS the number of My Doctor, any of them, and someone will call you back. You can call or beep if you don't have airtime. They will call you back. You can WhatsApp the number and someone still will call you back. You can also go ahead and go on www.mydoctorem.org and then use our very amazing chatbot. We are still using our beta version 1.0, but we are working on a very extended platform that brings out all the other conversation of the things I told you about. So come June, as we shall be at the Middle East and Africa Digital Transformation Summit, we will be blessed as well to launch the most amazing African customized chatbot that anyone will ever find on the African continent. And guess what? Can you guess? My Doctor's Chatbot is actually powered by ChatGPT.
Wow.
So it's probably the most proven chatbot that anyone will find. And it is built by some of the most amazing technical guys. I mean, I'm one of the most amazing technical architects that you'll find in any space.
The interesting part about the chatbot that I was talking to Nicholas last week, and he mentioned how it even has 2 languages. It even has Luganda. So like any language you need, you just need to.
Yeah,
and that's really amazing.
It is very localized. Yeah. And also, we are happy to have the privilege of partnering with Makerere University Innovation Lab to work on it. And also what they call the Technical University of Munich. Yeah, Germany's #1 university and number 26 in the world. We are working with all of them and My Doctor to build an experience that will create a digitized healthcare community that supports and improves lives of every person across Africa in the most affordable way you will ever find on planet Earth.
Okay, so a bit of questions on the SMS and the phone calls. Are they free? Like when I call and then I want to talk to a doctor, right? Do I pay a certain type of consultation? How does that go? And what is the next step? Yeah.
Well, for now, beeping is free. When you yeah, when you beep, you definitely will be called at our airtime. You are the community president of My Doctor. You know that very well. SMSing, of course, comes at a cost of the sender. And when you call still, even when you WhatsApp, your data will be consumed, but no one is going to charge you for the consultation. Okay. And then we also have several WhatsApp groups, you know them, the community, and you're free to drop a conversation there. And doctors, clinicians, nurses are always available 24/7 to share feedback about this. And amazingly, whatever is happening in the space is being innovated by young people. They are all Gen Zs, the leaders, yourself, Joy, Bridget, our CEO, Dr. David, Nicholas, our CTO, every one of the people, our stakeholders. They're all people of this generation, so they are thinking. But they are solving problems of the youngest human being that has been born right now, or the one that will be born 1,000 years from now, and also the person who is 99 years or 100 years today. They're all being catered for in the same place.
Yes. Okay. Thank you so much, Mr. Innocent, for coming to this show. I'm sure we have learned a lot. I think I have to go and search for that wired phone. We have gone through a series of how technology has been advancing, and I'm sure we have understood where we're supposed to be going right now. So at this moment, I'd like to request you to give your closing remarks to the people, anything you'd want to tell them. Yeah.
Well, closing remarks sometimes can be like closing the door. I don't think that we actually have closed this conversation.
We're just opening
we're opening it. So we want to tell everyone, thank you for keeping here this long. It is nice that we spend some good time watching some sense being spoken. I know we are speaking a lot of sense with Madam President here, Joy, but I also want to tell you that digitization comes with immense opportunities for all of us. One of the things we've been doing over the last many years in collaboration with the Bill and Melinda Gates Foundation, what is now called the Gates Foundation, is extending access and advocacy for leveraging of digital solutions and innovations to solve problems of human beings across the planet. And we've seen millions of lives touched in very many ways. For instance, many of you that are watching, if you have used mobile money before, you can be sure that mobile money has closed gaps that were not closed by any other financial innovation for more than 100 years. In a period of just 15 years, more than 670 million people every month use mobile money to transact, to send and receive money. But I also tell you from a My Doctor perspective that over the last 3 years, we've been able to serve thousands of people that didn't have transport, that didn't have airtime to reach My Doctor's facility, but were able to either beep us, send an SMS, WhatsApp, or borrow the phone from the chairman or their friend, and were helped. But also importantly, we are creating a localized way of telemedicine. We are creating a multitude of community clinics where we take the services to the people. So we are saying power to the people. We are saying we are bringing healthcare to the communities where you are. As you've seen, Joy, in every place we go, people are crying loudly to have a doctor assess them and diagnose them, because they are also hustling to find the $2 to find food for their family for the day. So they don't have the luxury of going for tests that are very expensive in many of the public hospitals and the private hospitals, and many of them do not even have the money to transport themselves and the children. So digitization is the place to be, and My Doctor is that place where you'll find care anytime, anywhere.
Thank you so much, Mr. Innocent. Thank you for telling us these beautiful words. Hope people's minds have been opened up about telemedicine. So to our lovely people, thank you for watching this far. As we have been talking today, I think you've seen the many challenges we may be having. The doctor-to-patient ratio is still high, and that's why you go to the hospital and wait for long. The doctors are probably even overwhelmed with the patient ratio, and affordability is also still a problem. Most of the people in Uganda are living below the poverty line, and that's like they can't even afford $1 per day, so they can't access the services. So we have a long way to go. There was a study that was done during COVID-19, and they were saying that 70% of Ugandans are 1 hour away from a medical facility like a physical one. So telemedicine clearly is here to help out, to assist us, right? And so it's best we embrace it when it's early so that we move forward very fast. And for those who may need medical services, you've heard our services are fully free. We'll be putting the numbers down here. Just WhatsApp or call the numbers and you'll talk to a doctor for free and they'll be guiding you on the next steps, because we want everyone in Uganda, all over Africa, all over the world to be able to access medical services at their convenience and at an affordable price, right? So thank you for watching. This is My Doctor, your health anytime, anywhere.
My Doctor, your health anytime, anywhere.